But our mission really is to constantly empower communities to better take care of themselves. And basically, to make that a little bit more tangible, it's to make personal health monitoring free and more easily accessible. So with that, we aim to increase health and happiness levels, but also for serious illnesses such as chronic heart disease and diabetes, prevent some of those illnesses from happening. And I'm going to give you the bad slide here on what the problem is and why we've actually, why we're doing this. Chronic heart disease and diabetes, they're almost on epidemic levels on a global scale. And the UAE, 60% of the UAE population is obese or overweight. And wellness in the workplace is incredibly costly. In the US alone, it's about 2.2 trillion every year. And I think what's important to know is that although there's all these bad things happening, there's also lots of fantastic things that are happening, such as the internet. And a lot of searches on the internet, about 80% of those are health-related, fitness-related, diet-related. And we also all have mobile phones, which means that we're more easily accessible. And the other thing that's quite prevalent right now is wearables. And there are a lot of wearables on the market that give you lots of bits of data, such as how many steps you've done, how many kilometers you've ran, but they're not really giving us enough insights into how we can be healthier, how we can be better. For instance, if you've done 10,000 steps on your Fitbit, what does that actually mean? Does that mean that you should stay in and have a salad or a pizza, or should you go out, or should you go to the gym? So there's lots of these apps and wearables that are available on the market, but also the accuracy of these is a little bit kind of debatable and how accurate they are. On the other hand, what insights they actually give you. So I'm just going to show you a very quick video of...
We've designed the AI pod with people and communities in mind to enable them to better take care of themselves and prevent serious illnesses such as chronic heart diseases and diabetes. We've included state-of-the-art logging technology such as facial recognition and biometric scanning. Once inside the AI pod, the health assessment starts with measuring your weight and height, body composition and hydration monitoring, blood sugar monitoring, and blood pressure monitoring. This health assessment enables people to securely monitor their vitals and make positive changes to their lives. Once you've finished the health assessment, you're able to download our free-to-use app, where we have over 6,000 plans to help achieve your goals in dieting, fitness, sleep, maternity, and much more. We are super excited for this project to hit the UAE market, to constantly empower communities for a healthier and happier tomorrow.
We have the pods, which you've just seen, and they will be positioned in places like malls, pharmacies, inside corporations, outside of Spinners, a Waitrose, a Carrefour. And the idea of it and the design behind it is to actually encourage people to go inside there and do a health scan. It's non-invasive, so there's no needles involved, there's no technician involved, there's no doctor involved. And there have been other products on the market that have been similar to what we've done and do way more than what we do. But the problem's always been the fact that it feels like you're going to the doctors. And the fact that it feels like you're going to the doctors makes you almost feel like you're going to get medicated as well. I mean, how many times have you been to the doctors and you haven't walked out of there without a prescription? I think it's almost 99.9% of the time. And then we have our cloud, which is a private cloud where the data gets uploaded. And that goes to the apps, which is on Android and iOS. And then on the other side, we have the web apps, which enable community managers to manage these communities better. And we also have home health monitoring, which if you, for instance, if you can't make it to the pod, or if you aren't able to get out of your home, we have a bunch of devices that enable you to connect to our phone and do the same tests as if you were inside the pod. And we also connect to 50 of the top wearables out there, so your Apple Health and your Fitbits. So we're also able to get your ambient data as well. So just to give you a bit of a better idea of how this kind of works in practice, and this is where I'm sure you're going to have a few comments on where the data is going. On the right-hand side, you see the user experience, where basically the data goes up to the cloud, it then goes to the app. The user then can monitor their progress, but also they can share their health data as well. And many of you who have lived here for a while, when you go to the doctors, it's more than likely that you'll probably see a different doctor each time. You'll probably go to a different hospital or different clinic each time. And what normally happens is that they do a test on you there and then. They'll do a pre-examination there and then, which is your blood pressure, blood sugar, height and weight. But the problem is that they don't have any previous health record data. So they don't have any data from the last 3 or 4 months. And what you're able to do is share with your doctor some of this data that you've gathered over the last 4 or 5 months. And based on that data, they can give you a better prognosis. You can also then plan your activity, but as well as that, we have nutritionists, we have nurses, we have doctors, we have personal trainers on there. We have over 300,000 recipes. So for your nutrition, what we do is that as soon as you've uploaded your data, then it goes to the app, and there's a bunch of training programs on there as well. So if you're looking to lose weight, for instance, we'll have a nutrition plan and an exercise plan for you. If it's maternity, if it's sleep, we have a different plan. And then on the right-hand side, we have the data going to, for instance, corporations. And I'll give you a couple of examples of that on the next slide. But for instance, for hospitals, they're able to look and monitor this data. So for instance, if you have high blood pressure or high blood sugar, they're able to monitor this data and call you in before it becomes a serious issue. And gyms, for instance, I don't know how many of you started the gym in January after New Year's Eve and you want to go and get fit and get healthy, and in January you look at the scales and you weigh, in my case, 84 kilos, and then in March you still weigh 84 kilos. So it's not very motivational for you to see those figures. However, if I was to give you show you your fat mass has reduced and your muscle mass has increased, then that might be way more motivational for you. The other thing with gyms, for instance, is that once you go to the gym, you've had your first week with your personal trainer. After that free week, he doesn't interact with you at all, so there's no kind of there's no motivation to go to the gym. We provide personal trainers with the tools to enable them to be in touch with you more often and have a better understanding of how you're getting on. So here just gives you a bit of an overview of the different segments and how it can benefit them. So if we're looking at government entities, for instance, and one of the reasons I'm working with the Department of Health is they don't really have so much data on population health. And what we're able to do is that we're able to provide them with population health monitoring data that then they can provide, for instance, to the World Health Organization and bring their ranking down. So if they're looking at getting incremental gain year on year, then they can highlight certain areas of the city where people might be having high blood pressure or diabetes, and then go into those areas and combat them much better.